Welcome to MIGS Made Clear, where we break down micro-invasive glaucoma surgery into bite-sized chunks so you can walk away with a much greater understanding and feel more MIGS confident. Today, in this Part 3 video, we're going to talk about canaloplasty, or viscodilation techniques and devices that perform them. By the way, my name is Dr. Constance Okeke, and I'm an Ivy League, Wilmer Eye, and Bascom Palmer trained glaucoma specialist and cataract surgeon. This MIGS Made Clear 6-part video series is supported through an unrestricted educational grant from New World Medical, Nova Eye Medical, and Sight Sciences. As we break down this topic, we'll first quickly review angle anatomy and the mechanism of action of canaloplasty techniques. Then we'll discuss the available devices in this class: iTrack, iTrack Advance, OMNI, and Streamline. For each device, we'll go over what it looks like, its key features, the mechanism of action, its indications, and how it works surgically. Finally, we'll discuss contraindications to guide appropriate patient selection. Make sure to watch to the end to find out what we'll be discussing in the next video. So let's dive in. As an early MIGS adopter, I was eager to explore every new tool that could expand my armamentarium. My journey with canaloplasty began because I was seeking a technique that could address one challenge I was seeing in my practice: postoperative heme associated with goniotomy techniques. Colleagues shared their experiences with viscodilation, describing how for them it resulted in less bleeding, faster postoperative healing, and effective pressure-lowering outcomes. Intrigued, I decided to try it, and I found those advantages to be true in my patient population. Canaloplasty has since become an integral part of my surgical approach, and I'm excited to help you better understand how to incorporate it into yours. Lesson 1. Review of angle anatomy. Let's begin with a review of the angle anatomy involved in canaloplasty. As shown in this image, the key structures in the trabecular outflow system include Schwabe's line, trabecular meshwork, the primary site of resistance and outflow, scleral spur, ciliary body band. A solid understanding of angle anatomy is essential for correctly performing this procedure and achieving optimal outcomes. Please refer back to MIGS Made Clear Part 1A video on goniotomy/trabeculotomy to get more details on the angle structures if needed. Lesson 2. Mechanism of action. The outflow system consists of the trabecular meshwork, Schlemm's canal, and the collector channels. Canaloplasty targets Schlemm's by dilating the canal circumferentially up to 360 degrees and breaking up adhesions that can develop. It reduces outflow resistance, allowing the aqueous humor to flow more freely into the collector channels and episcleral veins, while avoiding bleb creation. By bypassing resistance, canaloplasty effectively lowers intraocular pressure reduction. Lesson 3. MIGS devices in this class and how they work. Now let's go over the devices that utilize canaloplasty. First up, we have the iTrack microcatheter. This is the first generation of the iTrack, and it is a flexible catheter with an illuminated fiber optic tip that allows real-time visualization during insertion and provides circumferential viscodilation of Schlemm's canal up to 360 degrees. Illuminator equipment is a requirement to perform iTrack. Let's watch the iTrack in surgical action. After creating a corneal incision to introduce the catheter into the AC, a goniotomy incision is created. Then the catheter is threaded into Schlemm's canal for 360 degrees, seen tracking with the illumination. As it is withdrawn, viscoelastic is injected, expanding the canal and breaking up adhesions. This is done while instructing the scrub nurse to simultaneously deliver viscoelastic via the visco injector. Due to some challenges with multiple steps for successful insertion with the first generation iTrack, the second generation iTrack was developed for enhanced efficiency and surgical experience. So next up, we have the iTrack Advance. Similar to the original, it has a flexible catheter with an illuminated fiber optic tip that provides canaloplasty in Schlemm's canal. But what is different is that it features a new handheld injector for easier use. It has an actuator for smooth gliding of the catheter in advancement or retraction, a nozzle that can be rotated for precise positioning of the cannula, and the spatulated cannula tip to easily access Schlemm's canal. The spatulated tip provides stability and precision, and the handheld injector simplifies deployment, eliminating the need for forceps to insert the catheter. iTrack Advance is the only device that can titrate the volume of viscoelastic delivered based on the patient pathology. It delivers 100 plus microliters of viscoelastic via a pressurized mechanism designed to overcome stenosis of the canal and collector channels. It also uniquely can catheterize 360 degrees of the cannula in a single intubation. Like the iTrack Advance is indicated for standalone use or in combination with cataract surgery for mild to moderate open angle glaucoma. It may be suitable for pigmentary or pseudoexfoliation glaucoma, ocular hypertension, post-SLT eyes, and patients with prior failed trabeculectomy or tube shunt with good angle anatomy. Let's watch the iTrack advance in surgical action. The surgeon uses the cannula tip of the handheld injector to pierce the TM and rest against the scleral wall, parallel with the Schlemm's canal. The actuator is advanced and inserts the catheter into Schlemm's canal for up to 360 degrees. Then the actuator is retracted, dilating the canal with viscoelastic. Note that the iTrack device, if inserted into Schlemm's canal and pulled internally, it can be used to perform gap. Refer to MIGS Made Clear Part 1B for details on this. Now we move away from the iTrack family and move to the OMNI surgical system. The OMNI system's key feature is the ability to combine canaloplasty and trabeculotomy in one device. We also spoke in detail on its mechanism for trabeculotomy in Part 1B video. Refer back to that for details. The OMNI is a compact device with an ergonomic handle, a hollow microcatheter for dual action, and a reservoir that is filled with viscoelastic to deposit controlled amounts as the microcatheter is retracted through the Schlemm's canal. Let's watch the OMNI in surgical action. After piercing the trabecular meshwork with the tip, the catheter is advanced with a finger wheel for up to 180 degrees. Then the catheter is retracted, allowing for delivery of small amounts, about 5.5 microliters per hemisphere, of viscoelastic fluid into Schlemm's canal. This can be performed on both sides for up to 360 degrees of dilation. Next up, we have the Streamline surgical system. This versatile device can be used for both canaloplasty and goniotomy procedures, depending on the technique used in surgery. We discussed the goniotomy feature in the Part 1A video. Refer to that for more details. Similar to the iTrack family and OMNI, the Streamline surgical system is an implant-free, single-use device. It is intuitive to learn and use with one-hand operation and button depression of the click pulse technology. It is filled with viscoelastic to be primed for delivery. It features an outer sleeve that retracts with button depression and serves as a guide to position the tip of the dispensing inner cannula against the desired area within the anterior chamber. The inner cannula is fixed and does not move forward during the procedure. However, as one depresses the button, viscoelastic is delivered into the Schlemm's canal. This can be performed multiple times across the angle, up to 8 total applications. Here is the Streamline in surgical action. After insertion of the device, the blue outer sleeve is pressed against the pigmented TM, and then the button is depressed to retract the outer sleeve and deliver the inner cannula that pierces the TM and delivers viscoelastic. This is repeated up to 8 times, typically in the nasal quadrant. All canaloplasty devices are indicated for open-angle glaucoma patients with mild to moderate stage that is controlled or uncontrolled. This can be done as a standalone in phakic or pseudophakic patients, as well as combined with cataract surgery. An ideal patient for canaloplasty techniques is on 0 to 3 medications with wide open angles on gonioscopy and a clear angle view. The CPT code for canaloplasty is 66174. With the techniques all being available through a handheld device, choosing which one is best for your patients comes down to comfort with the technique and best patient outcomes in your hands. Now, what are the contraindications for canaloplasty? It is contraindicated in patients with narrow angle glaucoma or chronic angle closure, extensive surgical histories that preclude Schlemm's canal access, significant angle recession from trauma, or neovascular glaucoma. So let's recap today. We reviewed canaloplasty techniques, angle anatomy, and the unique features of the iTrack, iTrack Advance, OMNI surgical system, and Streamline surgical system devices. We discussed some of the points to help with patient selection as well. Now, before we wrap up, here's what I'd like you to do next to get the most out of this series. Subscribe to the iGlaucoma YouTube channel so you don't miss any videos in the series. Share this video with other eye care providers who might also benefit. And check out the resources linked below, including guides on adopting MIGS and understanding real-world MIGS outcomes, and also getting a sneak peek on what's to come with MIGS Made Clear. Don't forget to grab your copy of the Glaucoma Guidebook, Expert Advice on Maintaining Healthy Vision for Practical Tips on Managing Glaucoma. Finally, if you have experience with canaloplasty techniques, or if you're interested in learning more, leave your thoughts in the comments below. Your feedback is helpful to us to continually refine the content and make it as informative and as relevant as possible. Whether you're managing mild to moderate opening of glaucoma or looking for a technique with potentially fewer postoperative complications, canaloplasty offers a versatile option that helps patients maintain healthy pressures without the need for blood formation. I hope this breakdown clarified the advantages and applications of canaloplasty techniques and boosted your confidence in selecting the right tools for your patients. Thank you for watching, and remember, every step we take in understanding MIGS brings us closer to improving glaucoma care. Stay tuned for the next video where we will be discussing subconjunctival stents and continuing to make MIGS clear one technique at a time.